If you or a loved one is living with cancer, you probably have two focal points: how to rid yourself of it and how to prevent it from coming back. You'll get some terrific information today on Cancer Concepts and Complements with Dr. James Belanger. We'll explore natural medicines which may enhance conventional therapies, share cutting-edge research, and offer insight on how diet and natural medicines can play an important role in treating and preventing cancer. The information presented herein is in no way intended as a substitute for medical counseling. Now, here is Dr. James Belanger.
Hello, everyone. Welcome to Cancer Concepts and Complements. I'm your host, Dr. James Belanger from the Lexington Natural Health Center in Massachusetts. Today's topic, I'm going to talk about colon cancer. Colon cancer, unfortunately, is the third most common cancer in the United States. Skin and lung are the first two there, and it's the second leading cause of cancer-related death in the U.S. So a lot more research needs to go into trying to improve the statistics for colon cancer, and I'm going to share with you today about the natural medicine research that has been conducted. First thing I do when a patient comes in to see me with colon cancer is determine their stage. What stage are they in? Most people come to see me with colon cancer when they're either in the stage 3 or stage 4. Stage 3 means that the colon cancer has spread outside of the colon and involving the lymph nodes around the colon. And then stage 4 is when it has spread more distantly, often the liver and sometimes the lungs. And a lot of patients that have stage 3 colon cancer, they have the surgery and then they follow that with some chemotherapy regimen. The most common chemotherapy regimen for stage 3 colon cancer, it's called FOLFOX. It's composed of two different chemotherapy drugs. One is called oxaliplatin and the other one is 5-FU. And that's a common regimen given after surgery to try to prevent the risk of getting a reoccurrence, often a metastatic reoccurrence. But even when patients do this FOLFOX treatment after having the surgery, if they're stage 3, they can get a reoccurrence in 3 years, like 25% reoccurrence rates 3 years later, even after doing that. And this is where the natural medicine can come into play, is helping the immune system fight cancer that wasn't destroyed by this chemotherapy. Talk about diet and other laboratory tests that can assess the growth factors that lead to a reoccurrence. Do something about it so 3 years later they aren't faced with more chemotherapy and a worse prognosis. If a patient comes in with stage 4 colon cancer, then they're often offered one of two different regimens. They often use that same regimen they use for stage 3. It's called FOLFOX, oxaliplatin, and 5-FU. And then there's another regimen that's often offered called FOLFIRI, which is 5-FU, the same drug in the other regimen, along with a different drug called irinotecan. But patients with stage 4 colon cancer, unfortunately, have a worse prognosis, and those drugs typically only work in about 34% of the patients, and it only lasts typically 7 months before it starts progressing. And so again, natural medicines to try to complement these chemotherapy regimens to make them work better. So the first thing I do often when a patient comes in to see me, once I determine their stage, so say they have stage 3, is I'll order some laboratory tests. And one test that I'll often order is a test by this company called RGCC. RGCC stands for Research Genetic Cancer Center. They are a laboratory located in Greece. And they have a technology, which is available in the U.S. too, but they do some extra testing that is not available in the U.S. They isolate cancer cells from a patient's blood. So if a person comes in with stage 3 colon cancer, where it has spread outside of the colon into the lymph nodes, they can possibly have cancer cells in the blood. And there's research showing that if they do, they will more likely have a reoccurrence, and that you want to do some further treatment than just doing the chemo for a period of time and watching and waiting for it to come back. There's a study in the British Journal of Cancer in 2013 where they took 90 patients with stage 3 colon cancer. After chemotherapy, they looked for cancer cells in their blood, and those that had cancer cells in their blood were more likely to have a relapse during the 6-month follow-up. Actually, it was even longer than that, but it was actually 6 times more likely to relapse in patients that had cancer cells still in their blood even after completing a FOLFOX regimen, the chemotherapy regimen. So by doing this test, RGCC has a test called the OncoQuick isolation technique, where they take a blood sample and they spin it down and they separate cancer cells from red blood cells, white cells, platelets, and detect to see if you have it. If you do come back positive, this study in the British Journal of Cancer indicates that you're 6 times more likely to have a reoccurrence, and that's when some natural medicines, or maybe even possibly some other conventional therapies, could be useful to keep you from getting a reoccurrence in the liver or the lungs later on. Another thing I will do in patients if they have stage 4 is do this RGCC test, but also have them do what's called a chemosensitivity panel. So they can take it a step further, where they isolate the cancer cells from the blood, and then they grow them in cell cultures and then incubate them with various types of chemotherapy drugs to see which chemotherapy drugs induce cell death the best in the colon cancer cells. There's 2 regimens I mentioned for stage 4 colon cancer. One's called FOLFOX, and the other is called FOLFIRI. And research says that those regimens are equal. They produce the same results, about a 30% response rate, and lasting for about 7 months. But there's sometimes one of those regimens works really good for one patient and not well in another patient. And it's basically a guess. A doctor will say, okay, well, let's try FOLFOX and see how you respond to it. I think you can handle that regimen, and let's try it out. And you might be in that 30% that do respond to it. Or they might try the FOLFIRI. The research says that they work equally the same as a whole. But as an individual, one regimen might work better for you. This lab in Greece will check oxaliplatin, the drug that's in FOLFOX. We'll check 5-FU and check this irinotecan drug that is in the FOLFIRI regimen and see which of those drugs work best for you. They also take it a step further, is besides actually incubating your cancer cells with the chemotherapy drugs to see which kill the cancer cells the best, they will look for certain markers that can predict resistance to a chemotherapy drug. For example, if you're given oxaliplatin, cancer cells can slowly become resistant to that drug by making something called glutathione. Glutathione is a compound cancer cells can do to neutralize the effects of oxaliplatin, prevent it from damaging themselves. And RGCC will measure some enzyme called glutathione S-transferase, and research says that if that is being overexpressed in a cancer cell, it's more likely to resist oxaliplatin, but not the irinotecan. They'll also measure other repair enzymes that lead to resistance to oxaliplatin. They measure something called DNA methyltransferase. Again, if you have that overly expressed in the cancer cells, the FOLFOX regimen might not be the best for you. The FOLFIRI might be the better regimen. They will also check something that the FOLFIRI regimen will target. It's called TOPO1. And if you have a lot of that in the cancer cells, then that indicates that irinotecan drug that's part of this FOLFIRI will work better. So they look at it in 2 different angles. They actually incubate your cancer cells with these types of chemotherapies that are being offered to you and measure amount of cell death after 6 days of incubation with those drugs. And then they look at it in a different angle. Do you have anything in the cancer cells that are going to allow them to be more sensitive or less sensitive to the drugs? And then they print out a report after it takes usually about 10 days or so, and give you a report. And then that can be shown to the oncologist, and using that data to more accurately predict the best chemotherapy regimen for you, FOLFOX or FOLFIRI. Okay, so another benefit of the RGCC test is that they will test natural medicines as well and see if certain natural medicines can induce cell death in the cancer cells that were isolated from your blood. And this is really important too after you're finished off with chemotherapy, especially if you do have some circulating tumor cells still found in your blood that puts you at risk for a reoccurrence. And the doctor's like, well, you're done with chemo. We don't see any evidence of cancer. Let's watch and wait. Well, if you have evidence of still cancer cells in the blood, you are at a higher risk of reoccurrence, and there are natural things that could be added to your regimen that might help induce death of these cancer cells, and RGCC will test them. There's one product that has been researched in people with colon cancer showing that it can reduce the risk of a reoccurrence. It's called Avamar, MAR. And what it is it's a fermented wheat germ extract. So they take wheat germ and it's fermented. And wheat germ, when it's fermented, has this compound in it called benzoquinones. And that they think is the active compound. And it actually it might work in different ways, maybe help the immune system, natural killer cells or T cells, but it also might help prevent the cancer from replicating its DNA to help grow that way. And there's research done in at the British Journal of Cancer, 2003, where they took 64 patients and they had just chemo alone or chemo with this Avamar, and they compared it in progression-free survival after 70 months. 70% were free from progression in the Avamar chemotherapy group versus 40% in just the chemotherapy group alone. And this is something that you can send a sample of Avamar to RGCC, and they'll incubate it basically with the cancer cells and see if it kills them, to see how sensitive it is to Avamar. Because not just like chemotherapy, not all cancer cells will be sensitive to it, but if it shows up really strongly in the grease test, that's another plus for trying this product. Well, that's one of many products that have been studied to induce cell death of cancer cells, colon cancer cells. Another one is called mangosteen. Mangosteen is a fruit, often growing in Thailand and other tropical areas, and it looks like lychee fruit and other fruits, where it has this outer pericarp or rind they call it, and then the actual fruit inside. Well, it's that outer rind part that has been studied to contain these anti-cancer compounds called xanthones. And so they've done this is an animal study and published in the Journal of Natural Medicine's 2013, where they gave animals colon cancer, and then they gave them an extract from this rind or the pericarp of mangosteen, and it induced a 50 to 70% reduction in tumor size after the end of the study period, and improved the lifespan, doubled the lifespan of the animals bearing the colon cancer. And it induces cell death of the cancer cells. So again, RGCC can take a sample of mangosteen, an extract, a concentrated extract. It has to be concentrated for a particular xanthone called mangosteen. Mangosteen. That is an active compound. It's not like found in the fruit part. So if it's just a juice from the fruit, it's not going to contain that much of this mangosteen. The pericarp, the rind, is what has it in there. And a good company that has standardized and measured that mangosteen, that is one of the active compounds in there. And that's what they have studied in this Journal of Natural Medicine in 2013. That can be sent to RGCC and tested. Other compounds that have shown to induce cell death of colon cancer cells in either animals or people is quercetin. Quercetin, I'll spell it. It's Quercetin. This is a bioflavonoid found prevalently in onions and any of the onion family. And it's also found in apples and stuff too, but a lot of today's apples are very low in quercetin. There's more in the tartar apples or the wilder apples than like a Golden Delicious. But it's found in plants as well, and it's commonly taken from this plant called the Sophora plant, and that's where a lot of the supplement companies get it from. Well, there's a study done in this journal called Apoptosis in 2012 where they gave mice quercetin, and then they measured the growth of the colon cancer compared to a control. They just carried it out for 24 days, but it was 2/3 the size in the quercetin group. So another compound that can be tested in the RGCC that induces cell death of colon cancer. Cranberry is another one. Berries. I always tell people if you're going to eat any kind of fruit, you want to eat berries. From cranberries, blueberries, strawberries. Black raspberries have also been studied for colon cancer. There's some research being done. I think it was Johns Hopkins where they gave people a freeze-dried extract of black raspberries and then did surgery, and there was some signs of cell death in the group that got the black raspberry powder versus the group that didn't. But cranberries have also been studied in animals where they gave them a flavonoid-rich. That's the thing that's in cranberries called bioflavonoids, and they can concentrate those things in extracts and in pills and stuff. And they measured the growth of the colon cancer, and it's 2/3 the size 40 days later versus the control group. So a lot of these things, the cancer still grows, but it slows it down. You couple them together, you might have a synergistic effect. Quercetin, cranberry, mangosteen, all together. Then lastly is another natural compound that can be tested at RGCC is an herb astragalus. Astragalus is a root commonly used in traditional Chinese medicine, and it contains different compounds. Polysaccharides are one of the compounds in them, and saponins are another thing. And the saponins come out in what's called a methanol extract, and the polysaccharides come out in a water extract. Well, the polysaccharides I'm going to talk about later help the immune system, start to see the cancer better. And so they have astragalus water extracts that could help the immune system. But the saponins that come out in another type of extract, a methanol extract, actually can induce cell death of colon cancer cells. And that is what's been studied in this journal, Carcinogenesis, in 2007, where they gave mice colon cancer and gave them the saponins from astragalus and 40% reduction in tumor volume after 21 days. And they even combined it with the chemotherapy drug 5-FU. That 5-FU drug is used in both regimens for stage 4 colon cancer, FOLFIRI and FOLFOX. And when they combined the astragalus with it, there was a 66% cell death. So it was better. That was comparable to FOLFOX itself, oxaliplatin and 5-FU. So there's a synergy of astragalus with 5-FU that needs to be researched more. And it was done on the saponins. So that is something that also could be tested at RGCC, a sample of astragalus saponins, and seeing how sensitive the colon cancer is. Okay, I got to take a break. And when I get back, I'm going to talk about natural things that can enhance the effectiveness of the FOLFOX and FOLFIRI regimen. This is Cancer Concepts and Compliments.
This is Cancer Concepts and Compliments with Dr. James Belanger. The information presented herein is in no way intended as a substitute for medical counseling. If you would like to find out more about the Lexington Natural Health Center, please visit lexingtonnaturalhealth.com. That's lexingtonnaturalhealth.com. Now, back to this week's program.
Hi, everyone. Welcome back to Cancer Concepts and Compliments. I'm your host, Dr. James Belanger from the Lexington Natural Health Center. Before the break, I was talking about a test by a lab called RGCC, and this test is very useful if you're starting to read online about this product is supposed to help your type of cancer or that product. I mentioned so far mangosteen and cranberry and astragalus and this and that. You know, there are people out there that product might have helped them a lot, but that doesn't mean it's going to help you. If the product is supposed to work by inducing cell death of the cancer, then that is what they test at RGCC. They mix the cancer cells with that particular compound, the particular compound that you are thinking of taking, and they determine if it does induce cell death. That doesn't mean that product's not going to work through another mechanism. Like I mentioned, astragalus, for example, does help the immune system if it's what's called a polysaccharide extract. And that doesn't induce cell death, but it helps your immune system fight the cancer. But if a product like the astragalus saponins are supposed to induce cell death of the colon cancer, well, then they have ability to test that, which helps you sort through a mixture of different natural compounds that might be you reading or presented to you by a family member and help figure out what is maybe best for you. And the same thing applies with the chemotherapies often being offered to you. Okay, so the two main regimens for colon cancer, if you have stage 4, is FOLFOX and FOLFIRI. Well, once you find out what the chemotherapy is best for you based on the RGCC test, then there are natural medicines that I often will choose to pair with them to improve. Because, like I mentioned, even if you went on the drug, 30% of people respond to it, and that response only lasts typically 7 months before it starts progressing, and then you're on to another regimen. And anything that could possibly be done to help improve the response rates and maybe even reduce a remission so you can get off of the chemo and maintain it with diet, exercise, and some natural medicines for your immune system. Well, there's an interesting study that was published in Germany, but Dr. Hans did this study on ginkgo, where he took patients with colon cancer that were already progressing on the chemo drug 5-FU. This is an older study where they didn't have the oxaliplatin, but they were progressing on 5-FU, and he added ginkgo, that natural compound that you hear about for Alzheimer's disease. It's for helping improve blood flow to the brain. Well, I mentioned before in other of my talks that ginkgo helps improve blood flow everywhere, and it helps improve delivery of chemo to wherever the cancer is. So this Dr. Hans gave intravenous ginkgo and found that 2 of 32 patients that were already progressing on 5-FU started to work again, and they got some shrinkage of their cancer. 2 out of 32, and 8 out of 32 stopped progressing. And all he did was combine ginkgo with the 5-FU. No follow-up studies on that, unfortunately, but that's another natural thing that should be looked into further. But it improves blood flow to the cancer, helping deliver it. And it does work orally as well. There's been some research done where they gave people around like 320 milligrams of ginkgo, and then they measured the blood flow in the capillary beds of the fingernails an hour later, and there was an increase in blood flow. And as long as the ginkgo was taken on an empty stomach away from food by like a half hour or so away from food. So it improves blood flow for about, it takes about an hour to do that. And if it's given multiple times throughout the day, it might help, especially around the time of the chemo. So that's something that needs to be looked into further. Selenium, now there's some very interesting research that's been completed at the Roswell Park Cancer Institute in Buffalo, New York, using different forms of selenium, the mineral selenium, and combining it with irinotecan, that chemo drug that is in the FOLFIRI regimen. Well, so in one particular study published in Clinical Cancer Research 2006, they gave people this compound selenomethionine. It's an organic form of the mineral selenium. And they gave it just a week before they started the chemotherapy. And these patients had already been previously on different types of chemotherapy. And it was a small study, 8 patients. And one patient was progressing on the chemotherapy before, and once they added the selenium, she then started having a response that lasted for up to 10 cycles, a partial response, where she was progressing before. The other 7 patients had no response. What was interesting is this one patient that did respond to the selenium when she wasn't previously responding to the irinotecan before. She was the smallest person, the lightest, and she achieved a blood level higher than the other people, a blood level of selenium. Because that's what the animal studies have been done on selenium, finding that a blood level of 1,800 micrograms per liter was necessary for selenium to help break resistance mechanisms in animals that were resistant to irinotecan. And she achieved that blood level, and she was the one who had the response, and the rest of them didn't do that. But it took like a couple months to achieve that. And the research that's been done in animals saying that maybe a good month of pretreatment of selenium, of this particular form of selenium, might be useful in order to help. So it's one of those things that if there's some time getting that into the system, it might help. And then before irinotecan resistance develops. But dose is also really important, and some people require more than that dose that they used in that one study, 2,200 micrograms. Some people might need higher doses. Now, selenium, you might read, has toxicity. Well, there's different types of selenium out there. There are what's called inorganic seleniums, called sodium selenite is the inorganic form. And then there's organic ones where the plant actually takes the selenium from the soil and converts into other forms. And those organic forms include something called selenomethionine and methylselenocysteine. For example, garlic is very high in organic forms of selenium, like methylselenocysteine, and that astragalus herb that I mentioned, the root of it, and asparagus is very high. Porcini mushrooms have that in there. And that's what that form, the methylselenocysteine, is what they've done most of the research studies on. And it's too bad that human study used a different form, selenomethionine, because this methylselenocysteine form is the one that gets converted into this active compound called methylselenol, and that it seems to have a much stronger anti-cancer effect than selenomethionine, which doesn't increase the methylselenols very much. So another human study that would be more useful is methylselenocysteine given a higher dose than 2,800 micrograms, checking blood levels and possibly urine levels of methylselenol, the active compound. Then they might have some better results. So unfortunately, there really hasn't been any more research done by this institute since 2007. I'm not sure if they lost the funding or not, but some very interesting research because they've done a bunch of animal studies too, showing that this selenium helps keep that irinotecan drug in cancer cells longer, and it helps activate it in the cancer cells, prevents it from being removed from the cancer cells, and seems to help only concentrate the chemotherapy in cancer cells and not in healthy cells. So there was very little toxicity. It actually reduced the intestinal toxicity from the irinotecan. And the only toxicity was it made people smell like garlic because it is a natural compound found in garlic. But even these massive doses of 6,000 micrograms a day didn't have any toxicity. And that's because they use the organic forms. The inorganic forms can have a lot of toxicities, even at 500 micrograms, so they should not be used. So more research needs to be done on methylselenocysteine, but encouraging stuff. Some other encouraging research done to enhance the effectiveness of chemotherapy is a compound found in green tea called theanine. This doctor, I'm not going to even bother to pronounce his name, Japanese name, published a study in Yakugakuzashi in 2002 on this compound called theanine and combining it with irinotecan in animals. So he gave animals colon cancer and irinotecan by itself or irinotecan with this compound found in green tea called theanine, used an equivalent of about 1,000 milligrams of theanine. And he found that the theanine helped keep the CPT11 or that irinotecan drug inside the colon cancer cells longer, and that allowed it to work better, and there was a significant tumor reduction compared to the irinotecan group alone. And what was really very interesting is it reduced the concentration of the chemotherapy in healthy cells. So they killed the animals and they checked the liver and the lungs and the bone marrow, and they found less chemotherapy in those healthy cells and more in the tumors, and then it caused greater reduction. Again, that was an animal study and hasn't really been any follow-up since early 2000s on whether it's going to work the same in people. But theanine has been studied in people. It's been shown to help increase a certain type of killer T cell, gamma delta T cells. There's some research on that, and it's been used for anxiety. So it's a well-tolerated compound and might have some benefit in enhancing the effects of the irinotecan drug. It's also been studied with cisplatin, which is the parent drug of oxaliplatin, so it might help oxaliplatin work better too, but more research needs to be done on that. Another natural compound that might make chemotherapy work better is resveratrol. Resveratrol is that compound that's found in grapes, so it's in wine, it's in chocolate as well. Lots of research done on that for a variety of conditions from cancer to cardiovascular disease. But there's been a bunch of studies showing that it can make 5-FU, the chemotherapy drug, work better. And that 5-FU is part of the oxaliplatin 5-FU regimen, FOLFOX, and the FOLFIRI regimen. Well, there's been a study done in this journal, I can't even pronounce it, RheumArc Microbiology Immunology 2013, some foreign journal in 2013, where they gave it animals, colon cancer, combined 5-FU with resveratrol or resveratrol alone, and the combined group had a much better effect. And the way it works is cancer cells, some of them divide, some of them don't divide. And 5-FU only kills dividing cancer cells. So I always tell people, think of cancer cells in different states. So some might be sleeping when you are getting the chemotherapy. Typically, you get 5-FU every 48 hours every 2 weeks. So if the cancer cells happen to be up and about dividing when you're getting the 5-FU, it could kill them. But if there's a lot of them that might not be up and about dividing at the same time you get the 5-FU. They're in a resting state. And if they're in a resting state, they're going to resist the 5-FU, and then they come out of their resting state at a different time. Just like some people work the night shift, some people work the day shift. Well, resveratrol helps them stay in this dividing state. They call it the S phase. And as long as it's given at the same time as the 5-FU, then it helps them die more because it locks them in there and keeps them out of that dormant phase. So that's how it possibly might work. And it's also been studied to make oxaliplatin work better too. So it might be useful to do a human study on resveratrol with Folfox. There's a study done in apoptosis 2014 where they combined resveratrol and oxaliplatin and in colon cancer, and it helped enhance the effectiveness of oxaliplatin. And that was done in Germany. Curcumin, good old curcumin, comes up a lot. Curcumin is that natural compound found in turmeric that's been studied for enhancing the effectiveness of a lot of chemotherapy drugs. What happens when cancer cells are exposed to various types of chemotherapy, like especially oxaliplatin? They feel, they get threatened by that. They're starting to die, and they activate these like life support systems, I call it. There's this compound called NF-kappa B, which becomes activated once a cancer cell gets damaged by chemotherapy, like the Folfox regimen. And it will cause the cancer cells to start making blood vessel growth factors to try to make more blood vessels to resist that way. It will cause them to become more invasive. It will cause them to produce things that suppress the immune system, prevent cell death from the chemotherapy. So it goes into this reactive state, this threatened state because of the chemotherapy, and it can turn on a lot of resistant cells. And so that's what a lot of the research has been done, is how can you shut off that signal that leads to resistance, that NF-kappa B signal. And curcumin is looking like a very promising agent. And they've done a lot of studies at MD Anderson on that. Well, one of the studies, Anti-Cancer Research 2012, took animals with colon cancer, combined Folfox with curcumin, and it markedly improved the results. 60 to 70% improvement in that regimen. And it helped inhibit that NF-kappa B, and thereby it helped prevent the cancer cells from making all these reactive compounds that'll protect it from the chemotherapy. It's also been studied with a oral form of 5-FU called Xeloda, which is often combined with oxaliplatin. They call it Xelox, Xeloda and oxaliplatin. And again, MD Anderson, 2009, they gave a pretty large dose. This is one thing. They used large doses of these things. It's not your typical one pill of curcumin is going to do these things that they're finding in the animal studies. They use like 9.5 gram human equivalent. That's a lot of curcumin. And 4 weeks later, the tumors were 1/3 the size in the group that got Xeloda plus curcumin versus just Xeloda alone. And what was really great is it reduced the metastasis of the cancer, preventing it from spreading by downregulating that NF-kappa B, that protective factor that cancer cells will release to resist the chemo. So more research on curcumin. Another thing, a lot of people like this one, caffeine has been shown to make chemotherapy work better. There's been a bunch of studies done on a particular type of cancer called sarcomas, where they give intravenous caffeine combined with various chemotherapy drugs, like cisplatin or carboplatin and stuff, and it helps it work better. But caffeine has been studied as well in colon cancer. International Journal of Cancer in 2002 combined the irinotecan drug with caffeine, finding that made it work better. And what happens is when cancer cells get damaged from a chemotherapy drug, they try to repair themselves so that they will not be, continue having that damage, and they'll continue to be able to divide. So they slow down their cell cycle. So before they actually can divide in half, they fix themselves. Anything that got damaged by that chemotherapy, they'll repair by slowing down their cell cycle. And then as long as they do repair, they don't die, even though the chemotherapy did damage them. And caffeine has been shown to prevent repair. Caffeine speeds things up. We all know that. It speeds up the cell, preventing them from having enough time to fix themselves, and forces them into a cell division when they're messed up by the chemotherapy and induces cell death. And so they've actually done studies with sarcomas giving intravenous caffeine plus chemotherapy, and it might make the chemotherapy work better. But they have done some animal and test tube studies in colon cancer, seeing that same effect. So that's another thing that might be looked into, is giving some caffeine either orally or intravenously after chemotherapy. There's a compound found in cabbage and broccoli called sulforaphane. Sulforaphane. It's found in broccoli. Broccoli sprouts are really high, where you take the seeds of the broccoli and you sprout them. And this compound sulforaphane has also been made to help made 5-FU work better in colon cancer. And then lastly, melatonin has been shown. This is a study done in people. Anti-Cancer Research 2003 in Italy. They took 30 patients with metastatic colon cancer, and they had already been previously on some kind of chemotherapy like 5-FU. But this one they gave the irinotecan drug plus melatonin, or irinotecan alone, and patients that had the melatonin had 5 out of 14 had a partial response with the melatonin plus the irinotecan, versus 2 out of 16 in the chemotherapy alone. And then 7 out of 14 had stable disease with melatonin plus the CPT-11 or the irinotecan, versus 5 out of 16 with chemo alone. And it also reduced the incidences of diarrhea, because the irinotecan can cause some intestinal effects. So not a huge improvement, but some improvement, very well tolerated melatonin, and also reduced some of the side effects of irinotecan. More research needs to be done on that. Okay, so I'm going to take another break, and when I get back, now we're going to talk about additional things besides chemotherapy, natural things that can help the immune system fight the cancer better and take away growth factors that can stimulate growth of colon cancer. This is Cancer Concepts and Compliments.
This is Cancer Concepts and Compliments with Dr. James Belanger. The information presented herein is in no way intended as a substitute for medical counseling. If you would like to find out more about the Lexington Natural Health Center, please visit lexingtonnaturalhealth.com. That's lexingtonnaturalhealth.com. Now, back to this week's program.
Hi, everyone. This is Cancer Concepts and Compliments. I'm your host, Dr. James Belanger. Before the break, I was talking about natural medicines that might make chemotherapy work better to improve the response rates and disease-free progression rates of the chemotherapy. But now we need to talk about other things, so we're not relying solely on the chemotherapy to do the work. It's how to get our bodies to help see that cancer and fight it. Because obviously there's a problem with the immune system. If the cancer formed in the first place and spread to lymph nodes or even distantly to the liver or lungs, there's got to be something wrong with the immune system. Why didn't it see that cancer when it was very small and respond to it and eliminate that? There's problems with the immune system, and you can do laboratory tests to detect those problems, and that is not being done currently. Chemotherapy doesn't help the immune system at all. It can hurt the immune system. And especially when you're in stage 3 and you finish that chemotherapy regimen and you're left to watch and wait over those 3 years and see if you're going to get a reoccurrence or not, this is a perfect time to start doing things to get your immune system to see cancer better. And you can't feel that. You can't feel how your immune system responds to cancer. There are laboratory tests that can determine this. But right now, there's no really conventional approved therapy that helps your immune system fight colon cancer. But there's all kinds of natural medicines that can do that. But we do laboratory tests to individualize and select these natural medicines for you, and then you can repeat those laboratory tests to see if your immune system is really now better responding to colon cancer. So the first thing is we have these cells, they're called dendritic cells. They look like an octopus, and they basically go around inspecting in your body. They're inspectors, and they have all kinds of arms, so they can take samples from all kinds of dead cellular debris. And then they go to lymph nodes nearby and present what they found with all these arms that they have. And they present what they found to these cells called T cells, T helper cells in particular. And the T helper cell is designed to recognize, is that a normal protein there that the dendritic cell is showing them, or is there something abnormal about it? Like, is it a foreign body, or is it some mutated protein from a cancer cell? And then the T cell may become activated, the T helper cell, and it's like a messenger. And then it says, okay, whoa, That's a problem right there. And then it will start to expand itself, and then it will activate what's called killer cells, killer T cells, natural killer cells, and then those cells then migrate to wherever the dendritic cell found that protein and destroy the cancer cell attached to those proteins. And that's how the normal immune response is supposed to work. Well, what happens if you don't have enough inspectors? If you don't have enough inspectors on the job, things can be missed, and that's exactly what they have found in people with colon cancer, that they have commonly have low levels of dendritic cells. There's a research study showing too that if patients had low levels of dendritic cells, they are more likely to have lymph node metastasis or distant metastasis. So that is something that can be measured, is the amount of dendritic cells in the blood, but they're also in the tissues, but you can't measure that. You measure it in the blood and do things to improve it. Well, my favorite agent, because it's been researched, is called AHCC. There's a study done in Nutrition Cancer 2008. They use this compound. It is derived from the cultured broth of shiitake mushroom mycelium, it's called. So the root system of the shiitake, when it's cultured into this broth, there's these compounds called alpha glucans that are the possibly active compound that has been studied. And so they call it AHCC, and they used 3 grams a day of this particular thing. So it wasn't just eating, shiitake mushrooms or anything. It's this compound found in it. And there was a 64% increase in dendritic cell counts after 4 weeks. So that is something that can improve the numbers of dendritic cells. So that might be a useful thing, especially if somebody has low levels. Okay, the second thing now is the dendritic cell I mentioned comes in contact with the T helper cell. So once it gathers the proteins that it inspected, it presents them to a T helper cell in some nearby lymph node. And then the T helper cell should become activated. So it's going to do something about that. So the dendritic cell releases something called IL-12 or interleukin 12 and something called gamma interferon. And that helps the T helper cell become more activated. And then the T helper cell clones itself. So now there's lots of messengers to spread the word that there's cancer somewhere in the liver or the lymph nodes. And that interleukin 12 and the interferon gamma are necessary for the cloning and the proliferation of the T helper cell. Well, there's been research showing that if a patient doesn't produce enough interleukin 12 and gamma interferon, that they're more likely to have the cancer spread. There's a study done in Disease Colon Rectum 1998 where they measured interleukin 12 production from the T cells and the dendritic cells, and those that had low levels were more likely to have positive lymph nodes, and those that had normal levels didn't have lymph node involvement. So if you have that reduces the likelihood of the cancer spreading, having good interleukin 12 production. So there's a lab test. It's called the stimulated cytokine analysis. It's performed at a lab called Pharmacin Labs in Wisconsin, where you send them a blood sample, and they take the white cells out of the blood that are sent, and then they stimulate them with different compounds to see, are they producing an adequate level of interleukin 12 and interferon gamma? And if they are, well, then you're in good shape. If they're not, then something needs to be fixed there, because according to this research and other, that might put you at more risk for a reoccurrence if you're in stage 3 or early stages, to try to prevent a reoccurrence. And then what can you do with that information? That's what's really nice about these laboratory tests. You can do something about this. There's research done, for example, on maitake mushroom. Another mushroom, not the shiitake, but the maitake mushroom has been studied in the Japanese Journal of Pharmacology in 2002, where they gave colon cancer to mice, and they measured interleukin 12 in a control group and interleukin 12 in a group given maitake. And the group given the maitake, they call it the D fraction. It's a particular extract from maitake, had a much higher level of interleukin 12 and gamma interferon from their T helper cells and dendritic cells. And what was really great was after 20 days, the tumors were 1/4 the size than the control group. So that's one natural compound often used if interleukin 12 or gamma interferon come back low in that blood test. Astragalus, I mentioned that earlier. Astragalus, Water extract, though, containing something called polysaccharides, have also been shown to help interleukin 12. So I'll use astragalus very frequently, and that has been studied as well. Okay, sometimes, what happens, the dendritic cell then comes in contact with the T cell, and the T cell, will start to proliferate. But the cancer releases compounds to prevent the T cells from becoming activated and from cloning themselves. So it actually causes cell death of the T cells. So it sets up, tell people, like a force field around itself to prevent your immune system from attacking it. And so there's all kinds of compounds that cancer cells can release that can paralyze your T helper cells from becoming activated by the dendritic cell. One of the things that they will increase is it's called IDO. It's an enzyme that breaks down this amino acid in your blood called tryptophan. So every time you eat anything with protein in it, it contains tryptophan. You probably heard it's in turkey and stuff, but it's in a lot of proteins. Well, tryptophan helps our T cells proliferate. And if you have that in your system, which most people do, the T cells, get their fuel. While cancer cells can make some enzyme called IDO, they can also cause another type of T cell called the regulatory T cell to make that. And it breaks down the tryptophan that is around the T helper 1 cells. And then this byproduct called kyurenin is produced, and it causes cell death of the T helper cells and prevents them from coming in good contact with the dendritic cell. So it squashes the message, like somebody cutting the phone line there. So it completely squashes the message. And there's research showing that because you can measure this kyurenin, it's a breakdown product of tryptophan. You can measure it in the blood. And if there's high levels of that in the blood, that means your cancer is making this IDO and breaking down the tryptophan. And there's a study in Molecular Biology Reports 2013, colon cancer patients. Their survival was much better, 80 months survival if they had low levels of kyurenin in the blood versus 57 months if they had high levels of that. So it's something that can be measured, and there's natural things that can lower it. Resveratrol, I mentioned, which is found in the grapes, can lower this IDO production from cancer cells and help lower the kyurenin so the T cells will not become paralyzed. Another thing that cancer can release is something called galectins. Galectins, they're called. And these are proteins that basically help the cancer cell adhere to blood vessel walls to spread. But they also impair the activation of the T cells by the dendritic cells. So it helps prevent the cancer from being seen by the immune system. Well, that's something that cancer cells can produce, and there's lots of types of galectins. Patients that are more likely to have cancer spread have higher levels of galectin. So it's something that can be measured in the blood. LabCorp is a lab that you can measure galectin. And if it's elevated, there's a natural compound found in citrus, found in that outer part of the citrus, the pectin, the stuff they make jelly out of. And they've modified it to make it more absorbable. They call it modified citrus pectin. Can bind, it doesn't lower galectins, but it binds to galectins, preventing them from interfering with the immune system and preventing them from helping the cancer spread places. So it's another very interesting thing. Another thing that cancer cells can release there's these, they call them interleukin 10 and interleukin 6. When a cancer releases interleukin 10 and interleukin 6, it can also impair the contact of the dendritic cell with the T helper 1 cell so that the message is never sent. And there's all kinds of studies done. You can look these up yourself. There's a website called pubmed.gov, pubmed.gov, and you type in interleukin 10 or interleukin 6 and colon cancer, and you'll see all kinds of studies showing that patients that have high levels of those are more likely to get reoccurrences, more likely to have spread of the cancer, shorter survival times. And then you can measure those things. They can measure it in the blood. There's a lab called LabCorp, Pharmacin Labs I mentioned, does that, and there's natural things that can help lower these things. I commonly use a herb called andrographis, a mushroom called cordyceps. There's research done on something else found in shiitake called lentinin. So there's all kinds of things that can take these things away from the cancer so they can't suppress your immune system. So your immune system can start to see it. And you measure them, and if they're high and they go down, well, that means that part has improved. Now your immune system is in better shape. So another thing is natural killer cells. So I mentioned the T cells, once they become activated, they stimulate natural killer cells and killer T cells. Well, sometimes that's the problem, is that the person's killer cells aren't working well. They're not able to destroy the cancer very well. And there's research showing that patients that have low activity of killer cells with colon cancer or have lower survival, more likely to get relapses, all kinds of things published on that. And there's a whole host of natural medicines that can improve the activity of the killer cells. I mentioned one of them already. AHCC is one of my favorite natural medicines to improve the activity of the killer cells. So that can be measured. You can send a lab, like Pharmacin Labs, a blood sample. They take the killer cells out of the blood and they mix them with cancer cells. And AHCC is something that can be very useful. So I hope you got a better understanding of how the lab fits in here, how natural medicines can improve your likelihood of staying in remission, or if you do have the metastatic, to help improve your overall survival. So you're not just solely dependent on the chemotherapy. Your body has a wonderful healing capacity. You just have to use nature, natural things on this earth to help enhance your body's healing abilities. Next week, we're going to talk about multiple myeloma. This is Cancer Concepts and Compliments.
Thank you for joining us this week. Cancer Concepts and Compliments with Dr. James Belanger can be heard live every Tuesday morning at 6 a.m. Pacific Time, 9 a.m. Eastern Time on the Voice America Health and Wellness Channel. We hope to see you next week for another show.